Professor knows loads and loads about food and health policy in the UK, inequalities, the whole thing. So I'm really fascinated to hear this seminar. So over to you, Jean.
Thank you, Pete. Yes, the introduction is always the most intimidating bit. Lecture's never made for a woman.
Sorry.
Okay, so I'll start by giving my acknowledgements. So most of the work I'm going to be talking about today has been funded by NIHR. And it seems that increasingly it's useful to also have a declaration about who I do and don't work with and who pays my salary. So benefit from the funding of the MRC unit, but they actually don't pay my salary. And I have worked, most of my research funding, I guess, as with most of you, comes from non-commercial sources. I am currently working with a recipe box company about whether a discount on that is a useful intervention, and they're paying for the discount, but they're not paying for the research itself. So the project that I'm going to be mostly talking about had a big team, some of whom are mentioned here. There was an even bigger team of research assistants who were based at Liverpool, who actually I didn't necessarily always meet, so I don't even know who they are. But there's a lot of people, and there's even more than here. And my acknowledgement to them all. Not all of the work that I'm going to talk about was necessarily directly led by me. So I don't know how many people here are public health people. I know that lots of people in the room are, and but for the people who are not kind of doing this stuff every day, I thought I'd just orientate you to that we have a problem with foods. We live in a world where less healthy food is very affordable. It's advertised, it's easily available, and this felt like enough. I just Googled food advert, and this was one of the first things that came up that kind of captured both all of these three things: affordable, available, and advertised heavily, all in one go, which was lovely. And this leads us to have a problem, this kind of food environment that's encouraging us to persistently pursue these less healthy foods is leads to a problem with diet-related diseases. So this is percentage of premature mortality in different world regions attributable to different aspects of our diet. And so about a quarter of premature mortality worldwide is related to diet-related causes. Things are not really getting better anywhere between 2010 and 2018. And the problems are driven by overweight, obesity, eating too much of processed meats and sugary drinks, and too little of all the things you know you should eat more: fruit and vegetables, whole grains, nuts and seeds. And those kind of persistent problems, I think, are not for one trying, at least in the UK, to do something about it. So this was work done by, her name was Dolly Tice at the time, when she was a student in our unit. And she documented all the obesity strategies we've had over the last 25 years. There are 16, I think, 14 obesity strategies that included 689 individual policies of things we might do about food and physical activity. And but these lines here are prevalence of obesity. So it doesn't seem like we've necessarily kind of turned the corner and brought prevalence down, although who can say what would have happened without these strategies. But Dolly's analysis of these strategies identified that most of them lacked clear implementation and enforcement plans. So we've got lots of good ideas. We don't necessarily know, feasibly, we don't intend for, government doesn't intend for them to be implemented and enforced well, but certainly they don't think about that when they're writing their plans. And also most of these policies, these 689 policies, are focused on providing education, information to encourage people to do the right thing. And we know from lots and lots of evidence that that might not be the most effective way to support people to eat better. And that changing the food environment, as exemplified by that Deliveroo advert, might be more effective in helping people change what they feed themselves. So more recently, there's started to be a focus on the out-of-home food sector, which is defined here as food that's provided for immediate consumption. So not packaged food that's provided for consumption to eat in, to take away, or to be delivered. And the focus on this is a bit because this is becoming more of our diet, and a bit because there's a kind of increasing recognition that it might be even less healthy than the other food we're eating. This is data from a database called Menu Tracker, which has been put together by Euroquan, a female student in the unit. So she identified all UK businesses with 250 or more employees that were involved in food, involved in serving food. So these are the businesses that, as we'll come on to, were eligible for implementing the menu labelling policy. And she looked online to see if they provided nutritional data. So this was before any information about nutritional content had to be provided. So not loads of them do. We think it's about 25% of businesses at this time in 2021 were providing nutritional information, about 80 of them. And she scraped the nutritional information. So this is just a simple descriptive of, she did it 4 times through 21. And she gets about 20,000 items per wave. So it's about 80,000 items served by about 80 businesses. And so they're like, so this is quite raw data, unclean, like there's a lot of coffee in there and a lot of variations on different sorts of milk. And so that's one of its limitations. It's not a complete data set because lots of people don't provide this information. But maybe we can assume that the ones that are doing really, really badly are least likely to have provided it voluntarily. Nevertheless, even in this context, a lot of businesses are serving food with a lot of energy in it. So this red line here is the 600 calories that, I don't remember if you remember this, a number of years ago, Public Health England said you shouldn't consume more than 600 calories per meal. So I do 400 breakfast, 600 at lunch and dinner. And then the blue line is 2,000, which is the kind of recommended per maximum per day. So about a quarter of items served by the out-of-home sector that was included here are over 600 calories. And similarly, when we look at fat, sugar, salt, there's loads of items that are over recommendation for a meal. These are items, so not necessarily a whole meal, so items more than recommended for a meal, and a noticeable number more than recommended for a whole day's consumption. So people are eating more of it. It's not very healthful, this out-of-home food. And there is systematic review evidence suggesting associations between both what you eat, the more out-of-home food that you eat, the less healthy your diet, the higher your weight, and the more likely you are to put on weight over time. So which is why people were worrying about it and where calorie labeling came into it, of what can we do about this food that people are eating, which doesn't seem to be very good for them. So there's 2 proposed mechanisms of why this might work. I think there is a kind of a really initial assumption of what was this ever going to do? So we'll just talk through what the hypothesis was of what it was going to do. And so the first mechanism is that just providing people with information might help them make better decisions. And it was never very clear what decision people were being asked to make, but maybe hopefully to purchase fewer calories. And then the second proposed mechanism is that restaurants might be embarrassed by what's in their food and not want to tell everyone there's like 1,500 calories in this portion. And so there might be a kind of a market realignment where they start to compete on calories and start to reformulate, either provide lower calorie items or reduce calories in their current offerings. So before this policy came in, there was like at best modest evidence that there might be a small effect from there was evidence that there might be at best a modest effect of both of these mechanisms. So some RCT evidence that you might get about 50 calorie reduction in purchasing, so that's the better decision mechanism, and that there might be reformulation to about 15 fewer calories per item. Okay, so maybe it might not work, but anyhow, let's do it, or it might not have a massive effect. And so people have asked me, why did you even get involved in this? So just to justify my decision, I thought that this was interesting, that the reformulation, that And I thought it was particularly interesting in the context of we might have a policy here that's being sold to people as educational, informational, and therefore kind of fits their preconceived notions of the best way to help people eat better. But that actually might work through changing the food environment by reformulation. And so I was excited to know whether we particularly could find evidence. And then we might be able, if we did, we might be able to think of other ways of kind of building on that, of how do we pitch policies so that they look attractive to you, but actually underneath are changing the food environment. So there is a long, I think, and maybe even longer than this, history of calorie labeling. So some of you will remember the public health responsibility deal, which was this, it was David Cameron's government, I think, idea that before we regulate you, we'll see if we can make you do stuff voluntarily better. So I've been there before lots of times, but so the idea was that there was these pledges for kind of more public health supportive behavior that businesses could sign up to. And one of them, so there was lots across lots of different public health domains. One of them in the food space was they could voluntarily calorie label. And it seems that 45 businesses signed this pledge. There was a valuation of the responsibility deal that found that on the whole, either the pledges were things that might not be particularly effective for supporting public health, or businesses didn't necessarily change their behavior. So they were signing up for things that they already did. But this is interesting in the context of 8 years later, Dolly looked at who was labeling voluntarily, so before the regs came in. And of the top 100 by sales, only 14 chains at that point. So I don't know what happened to the other 30. So that was the kind of, I think, that's my memory of when the first mention of it is. The first time it was mentioned in a legislative context was in, remember that child who was obesity strategy that has loads of really cool stuff in it that we're still arguing about whether any of us not slap this really kind of excellent have this like brand new world food environment. And that it did actually seem to progress quickly from there. They went to public consultation, as they have to do for new regulations, and then it's not quite clear what happened. The results of the consultation weren't published, but about a year later, NIHR, so DHSC through NIHR commissioned evaluation, which is what we did, and then things went quiet for quite a long time. I couldn't get an answer of what's the start date that I should put in my grant for quite a long time. And then it resurfaced in, this was the strategy that Boris Johnson released. Remember when he had COVID and then he said it was because he was overweight. So it's the same policy resurfaced, and then it seemed to gain a little bit more momentum. We published the consultation results from earlier here. I think there may have been another consultation on some other aspect of it. And eventually we got to implementation point at April 22. Okay, so what is it? So as I said, the regulations apply to large businesses with 250 employees who are selling any of these sorts of foods, so not prepackaged food for immediate consumption. Not all of your 250 employees have to be in the food sector. So this applies to, for instance, a hotel chain who have lots of chambermaids employed. And you have to provide information on the calories in essentially a single portion, or say that this is a sharer plate. And then it also has to be somewhere nearby. You have to have this statement about 2,000 calories. And it turns out what they mean by that is probably just somewhere on the menu. So we were commissioned to evaluate the policy in a, it was a commission call, so it wasn't entirely under our control what the evaluation might look like. So the limitations were, there was a whole list of research questions provided, and there was a budget provided, and it wasn't, I didn't think, reasonable to answer all the questions within the money. So we kind of had to do our best of which of these things can we do reasonably with the money available. But it's I mean, don't apologise at the start, but it did mean that I'm going to apologise. It did mean that this is not the most robust design that you could have thought of. So it was a compromise based on what they wanted to know and how much resource was available. But we did a pre-post assessment of how calorie labelling practice changed, how it influenced consumer behaviour, this bit that I was particularly interested in, how it influenced reformulation. And then we were interested in the process of implementation and enforcement. So there was various different bits, different methods that we used to address these questions. So we used in-store observations to look at practice. We used customer intercept surveys to understand impacts on customers, asking them what they bought and how much they'd eaten of it. We looked at impacts on consumers in more depth using an international survey that I'll tell you about. And then we used Menu Tracker, the scrape data, to look at reformulation. And we did some qualitative interviews at the end. So I'll go through all of this relatively quickly, and we can come back to details of methods at the end if you're interested in that. So to make our lives, to make the field workers' lives reasonably easier, an ideal would have been to look at practice across the whole country. We decided to focus our field work in 4 local authorities that we purposely sampled to be across the country. So, this is an England only policy, and across quintiles of deprivation. So the work is focused in these 4 local authorities. And for practice, they visited just over 100 outlets, both about 6 months before the policy came in and 6 months after. And so I've told you the details of the policy. You just have to do it. Provide the calorie labels somewhere near description of the item, and you have to provide the 2,000 kilocalories. But it happens that DH actually had previously published kind of best practice guidance for thinking about these regulations. If you were going to do this voluntarily, this might be how you would do it well. So we have these kind of 9 criteria of what good labelling practice looks like that we assessed pre-post. These other 3 are things that actually the Department of Health asked us to put in late stage, so we're only able to look at them post. And these were things that they had written into the legislation in a fairly non-specific way, like what does clear legible mean? And then you'll remember this, there was quite a lot of concern about this policy that it may have negative impacts on people with experience of eating disorders. So refocuses people on calorie counting, reinforces that's the only important aspect of food. And people with experience of eating disorders have described that they can find it quite triggering, like they're trying to not think about calories and then someone puts it. So DH's response to that was, you should have a menu available with no calorie counts on it on request. So people can ask for this. The default would be with calorie, but people can ask for it. And an assumption that people who wanted it would know that it was something that they could ask for. I don't think they particularly publicised this. Okay, so what we found, so red is pre and green is post. What we found was any labelling was done by about 80%. So all of these outlets we reckoned were eligible. I want a better word than that, but came within the purview of the regulations. So we reckon it should have been 100%. So there was certainly an improvement in labelling. And what would you call that? Like good compliance, but not perfect, I would say, even 6 months after the fact. And this was statistically significant increase in who was doing any, and also an increase in the score out of 9 that you got. This was done really badly. So this was a researcher saying, can I see the menu without the calories? And maybe it was available and staff didn't know about it, or maybe it wasn't available. But it was hard to get hold of that menu. Okay, so we also asked people as they were coming out of outlets, what did you buy? How much of it did you eat? Did you share it? Did you waste it? Well, how many calories do you reckon was in it? Or how many calories do you reckon you consumed? Did you notice the labels and Did you do anything as a result of noticing them? And again, this was pre-post. We used the same 114 outlets in the practice survey, and then we supplemented with another 200 or so, again, in the same four local authorities. And it, again, like 6 months before, 6 months after. So what we find, this is just the raw data, if anything, a small increase in calories purchased and consumed. But, I mean, this is important, positive finding. People were slightly better at estimating how many calories they'd eaten. So across the board, people underestimate how many calories they've eaten, but they were underestimating a little bit less. And these differences are not statistically, this is adjusted for both individual and outlet level variables. So no evidence of a difference in calories purchased or consumed, but some evidence that people are better at knowing what's in their food. What we did see was a big increase in noticing, so like about 100% increase in noticing. And this is like a small increase in people actually doing something with it. Because this is you only ask people who noticed, who used it. It comes out as a big increase kind of statistically, but it is just a small increase in the proportion of those who are noticing who used. Okay, so what we've got is definitely an increase in labeling, but not perfect. No impact on what people are buying or eating. Definitely people are noticing it. Not everyone, increase in people noticing it. So we wanted to dig into the noticing more and understand what people were using it for. And also, because we have access to this survey, it provides a slightly more robust study design to look at whether there was definitely change over time. So this is an annual survey done in a number of countries that do and don't have labeling. And so we were able to use this, and they just happened to ask about last time you were in a restaurant, did you notice nutrition labeling? Did you use it? So we just happened to have access to that information. And we're able to kind of do a difference in difference design. So to compare what was happening in England, where the policy was, other places where there was no policy, the comparator group there. So these are the questions that people were asked. Did you, if you've eaten out in the last 6 months, did you notice any information? What did you use it? What did you use it for? And then separately, so this is not just for the people who ate out in the last 6 months. Have you eaten out in the last 7 days? And this was important to look at because prior or during the consultation, as always, one of industry's arguments was that it would totally decimate their business model, and people would stop eating out because this was such an unpleasant thing in your face. So it was, we also had access to this, so we were able to look at this. So just orientate you to these figures. So we've got year along here. It's November each year. So this is November 21. The policy happened. November's policy happens about here, I guess, in April 22. And this is the adjusted probability of the thing. So this is the probability of people who noticed. Orange is the place, our comparator group, places with no policy, and blue is England. And you can just see what's going on by eyeballing the data, but the stars indicate where this difference is statistically different from immediately previous. So there's a bigger difference between England and in 21 than there is in 20. So the policy came in those 6 months after, about 4 or 5 months after this data. So this data collection point. So there's some evidence, I think, that of an anticipatory effect here of noticing. And that might be a combination both of, it probably had some media coverage. I heard a little bit about it, but I was attuned to it. And probably there were some places doing it early ahead of time, like they were getting their processes set up so that they know that they were adhering by April next year. So people noticing more, and that the effect was even greater after implementation. Also some evidence, like with our intercept surveys, that people using more, although that's kind of continue to grow. So then the question is, what are they using it for? And the only thing that we can really find is, well, they're ordering something different, but unfortunately we don't have questions on like more calories, less calories? Like, what are you doing about difference? So ate less of their orders, kind of some evidence that there was a kind of a small bump in that, but then came back down. And similarly, with change the restaurant you visited, maybe a small bump that came back down. And I don't think there's very much going on with eating out either, although, as I said, we've got a better question on that. So people may be using it to change what they eat, but don't really know in what way. This is the asking everybody about how frequently you've eaten out in the last week. This is obviously a COVID sort of bump. But apart from that, the COVID effect, no impact on how often people eat out. So industry can rest assured that people still love to eat out. Okay, so then the thing that I was interested in was whether this was going to prompt reformulation. We're going to have this magically improved food environment. And as I've told you about menu tracker, so we used September before to September after, again, just a pre-post assessment. And we looked at for most of the analysis, we looked at the whole landscape, just what was there. We didn't try and link items pre-post, although we did that in one little bit of the analysis. But we did stick to the same 78 chains that we had data from pre-post. So I won't linger on this for very long because there's loads here. But this is blue is pre, orange is post, mean calories stratified by like food group and chain type. But this is the overall effect here. You can see it. I'll tell you a bit more about that in a minute. But I think the interesting thing about this is really just to look at the ones on the edges. So that burgers are like massively highest calorie items. And of course, these kind of things that you sprinkle on the top are the lowest. So this is same data, but just showing the difference rather than the pre and post. And overall, the finding is there is a 9-calorie reduction. Statistically significant. Pre-post, which is driven by, interestingly, some of the highest calorie items at baseline, so burgers and mains. And also, I'm suspecting that pubs, bars, and inns are where burgers are most prominent, and that's why you see that effect. When we did link items pre-post to look at whether it was just menus are changing, so like there's just turnover of items, or items themselves are being reformulated, so changing the recipe of the same thing. What we find is that items that are removed are slightly lower energy than those that stay. We don't find any evidence of actual reformulation, like if you interpret that strictly. So no change in the items that were present pre-post. But the new items that came on were similarly slightly lower calorie than those that were removed. So maybe some of the higher calorie items being coming off and being slightly lower. It's small and it's not feeding through to our assessment of calories purchased or consumed. So I suspect that this is of the stuff that isn't consumed very much. So something going on, but not particularly important enough for us to pick it up elsewhere. And 9 calories is not very much. Okay, so the last thing was to explore how it had been for everyone. So we did qualitative interviews, both with people working in companies that had been affected. So what was their experience of implementation? And also people in local authorities who were charged with enforcement. So enforcement of this stuff gets done by local authorities. In this case, it was environmental health officers who are primarily responsible. We spoke to them as well. And we did this about 6 months after implementation. So enough time for it to kind of get bedded down, but not enough time. Like, I think you might find subtly different things now, like after we'd all got used to it. Right, so as with all qualitative studies, there's loads and loads to say. And the summary is that there were lots of different kind of regulatory, economic, business contexts that impacted on what happened. The thing that I'll just talk about most, though, is the regulatory context, because this tells you about what was happening with enforcement, and I think explains the 80% thing. So, I mean, I feel a bit naive that I didn't know this, but as it happens, one of the ways local authorities make money is act as advisors for businesses of how they should follow the law. So there are local authorities who took on this role of primary authority, which means that businesses could come to them and ask them, how is this menu labeling going to work? What is it you want us to do? If we do, and then actually take examples to them. If we do this, is that going to be okay? And they would have a negotiation, and we'd all agree exactly what does implementation look like. And because that had happened, all the local authorities kind of presumed that people were doing what they should do. We've had these conversations with you, so we presumed that there's this kind of context of presumed implementation. And that's further encouraged by, these are large businesses, often multinationals, and so an assumption that they wouldn't want to be embarrassed by not doing what they're supposed to do. So all sorts of presumed implementation, reinforced by everybody knew that there was no additional resource provided to enforce. So local authorities were told to do it within their existing budgets. And as it turned out, they don't really do it because they don't have resource, and it's really low priority, right? What things that they care about when inspecting businesses are hygiene and allergens. So things that are going to make you sick or kill you in the next 24, 48 hours. And for that reason, they're not really even visiting these businesses very much. Like, their business visiting the independents. They assume that McDonald's know how to keep a kitchen clean. Okay, so that, I think all of that explains 80%. And maybe cynically, I think this might have got worse over time, that you kind of get into a cycle of nobody's checking, so nobody will notice if we do it slightly differently, and then, you know, quickly you're not actually adhering to the regs. So now, some of the things I've noticed, for instance, are that I had to go in, like, I have to explain to you why I was in McDonald's. Now I got a punctured side. And they don't have calories on their board, on the menu board, which I presume is where most people order from. They have these electronic screens where you punch in your order, and they have a little QR code. If you want this calorie content, scan this QR code. It's not even on the electronic screen. And then, like, I was on another menu the other day because when work thing, you have to choose what you're going to eat 3 months ahead of time, and there you had to like toggle on to get the calories. Like, so the default was no calories, and you have to toggle on, which is the opposite of what it's supposed to be. It's default is supposed to be calories, you can turn them off. So I think there's lots of things like that going on, and obviously one of the things industry told us was that this was a bit of a bother, this data pipeline. You can imagine that it's a bit of a bother to develop this data pipeline. And clearly, I think that they were going through iterations of how best do we get this data to the consumer, knowing that it's going to have to change when we change our menus. So we need something that can be flexible to that sort of stuff. Okay, so this is the summary. Good adherence, not brilliant. No impact on calories purchased or consumed, but people slightly better at knowing what's in their food. People notice it. Not everybody notices it, not even half the people notice it. Some people notice it, may impact on what they order, doesn't discourage them from eating out. A tiny change in energy content of food, not enough to impact on what you eat. Probably not being enforced particularly well. So I started by saying that Dolly had done this analysis of these 689 policies and, or what was it, 14 strategies and 600 policies, and concluded that mostly they're written in ways that would be difficult to implement and enforce with no evaluation built in. And it feels like we're going around in circles. That's kind of the story here, right? That it's difficult to implement and enforce, no real plan for it. There was an evaluation, that's nice, I'll come back to that. But so that, I mean, there's a question of why do we keep going round in the circle? I think the answer is obvious, right? That there are vested interests from businesses making a lot of money out of selling not particularly high quality foods. And all resources are limited, and one of those resources is political capital. So even if there is someone in the policy space really trying to make something work, they are having to prioritize all the other things that they really want to make work. Eventually, they run out of political capital to make things happen, and compromises are made, and that's why you get policy inertia, policy failure. Kind of compounded by chronic diseases don't seem to be a problem today. They might be 30 or 50 years, but this is just not a thing that's not a problem we need to solve right in the next couple of weeks. And like I do think that this is the answer to why lots of things don't work, why Dolly was finding what she did when she did that analysis, and probably we haven't solved that problem, and that's why we keep doing it, and that's the problem to solve rather than come up with new policies. So, but the one thing they did do was commission an evaluation, which we should be really glad of, right? And pleased that they wanted to know what happened. And, it was interesting and kind of experience, it was my first experience of commissioned research from Department of Health. Sometimes they really, really wanted to know, can we know now? The minister is asking. And, sometimes they're really keen, well, what if you subgroup this way or subgroup that way? Could you just find something to say that it's positive? Other times, clearly, the minister didn't care and they were less interested. That's fine. But they commissioned an evaluation, and one of the reasons they did that is because 5 years after a regulatory policy, you have to review it and decide whether you still need the regulation, whether you should get rid of it, or whether you should optimize it, which is the bit that I think is really exciting. We rarely optimize policies. So I am stuck between, we know, Mike and Pete, about labeling, and we've learned some lessons about how to do label. If you want to do labeling well, it might not make masses of difference, but we know a bit about labeling, and that interpretative labeling with colors or shapes can help people quickly make decisions better than this. Can you see this? This is the calorie count. This might help you make quicker decisions and therefore engage with it a bit better. So we have some learning here that we could apply to this. Who knows whether that would happen? But if you wanted to optimize, I think that it's kind of obvious to know which direction you might optimize. And I'm torn between that, and I think my conclusion from our evaluation is this probably didn't work, didn't really change very much at all. And mostly when people tell me, well, there might be harms at the edges of public health policy, my response is, yeah, but the benefit outweighs those harms. Whereas here, the harms in terms of people with eating disorders or experience of have not been well documented. It's mostly qualitative research, not quantitative. But I am left wondering, well, I can't see any benefit, so maybe the harms do outweigh the benefit. So I am now, maybe you can help me with this, stuck between, should we push for better labeling, or should we just let this policy die? And that's it.
Thank you very much. Ending with a question. Not the normal way. It's only when we get the questions coming in this direction. See if people want to address it. And we definitely have time for questions for G. So, yes, Becky.
I was just curious with the enforcement. I know you said that they didn't really have the scope to do it, but were they looking at just checking whether the calories were there or whether the calories were correct? Because I remember I worked for a restaurant when this came in, and I remember the estimations were not very good, and the chefs kind of just did it quickly and got it on the menu, but it wasn't really very accurate.
So I think the answer to your question is neither.
Right.
That nobody was checking because they didn't have time for us to check. There was some in our qual stuff, some mention that, if a member of the public got in touch, we might then investigate, say that it wasn't there. Certainly, you're not the first person who said to me, or even noticed myself, that does not look correct. That either that's a wild over. So the policy allows for 20% plus or minus. It also allows for, you can use lab analysis, You could use McCants and Widdowson, so food tables. You can use a combo of both. Like the burger could be McCants and Widdowson, but you send your bun for analysis. So like there is scope for a lot of variation in what would be considered accurate. And I have previously felt that inaccuracies may undermine the whole thing. As soon as you see one that you think that's wrong, you just think it's all nonsense, so I'm just going to ignore it. So interestingly, the Department of Health were not interested in pursuing that. And I think it might have been this issue of it's so complicated to know what's correct because there's such a wide scope. But I agree that accuracy may play into the issue.
Yeah, I think that would be my only concern with like adding more information is that it would probably end up even more.
Well, okay, well, maybe then as a caveat, and maybe we should tighten up what what our definition of correct is.
Oh, Jean, thanks. That was great. I mean, about 1,000 things to talk to you about with that. So I guess maybe I'll say a word on the regulatory stuff. So speaking from an FSA perspective. So the thing to remember is local authorities, there's a regime which says how often a place has to be inspected, and it's much less often than you think. So I don't think it's that then just not going to some businesses. It's just that some businesses only get inspected once every 5 years. That's just the way it is.
Well, yeah, and they don't come up the priority list because we've no concerns. Like
no, it's not based on concerns.
But I think they do visit more often.
Well, they could, but that would be over and above the statutory requirement. Right. So there's a statutory requirement for how often they have to do it. But local authorities have got no resources, are scared, so things fall behind, and say we document that all the time. This isn't in the statutory responsibilities that they have to do. Although it's mandated, it's not one of the statute, and the DH could have made it that, and it would be super easy for them to check whether it's on the menu. Harder to check whether it's correct, but that does fall under trading standards. So if you provide information, that information legally has to be correct. But I think that the local authorities are not sampling really risky things, so they're certainly not going to start sampling how many calories in a burger. I think portion size is a big issue, not so much in the quick serve restaurants where you've got a very formulaic thing, but in restaurant I think that's a big issue. So I think the regulatory stuff's tricky, but we could tighten up on that if we wanted to. But I'm like you, I am so equivocal about this policy, and whether you should or shouldn't. If we are asking people like you're wrong to make more informed choices, they
might need some information.
They need to have some information. And I sort of make the analogy with the washing label on my jumper. I don't look at it that often, but sometimes you just want it to be there because you just want to know. So I think it's really hard. I do think the arguments against it are not evidence-based, but we are giving them a lot of airtime. Yeah, I think that's very, very, very tricky in terms of the risk and harm. I just don't know. I mean, Welsh Government are debating about what to do on this, but I think the accuracy issue does worry me. There was one study, I think, in the US looked at accuracy, which was
well. So we've done a little bit of work on accuracy.
But
there's variation.
Public health issues think about this.
Yeah.
And the other problem that we have to be very careful is if we start saying that labelling on out of home stuff, we shouldn't do, then you're really
exactly. Then you do
it labelling. However, can you justify that? Because arguably people do notice calorie labelling on menus more than they do in the supermarket where they're buying loads of stuff, they're going to put it all together, it's much, much less salient. So I think we're in that awkward place that now it's in. I think we really have to think through what will be the consequences of pulling.
Well, and that's what people at DH have said to me. So the thing on eating disorders, I did try and look into it both pre and more recently, and I agree there was approaching zero evidence pre. So we just didn't know. More recently, as I said, there seems to be a few qualitative studies of people describing this is not helpful for me, it's making my life worse. I could only find one quantitative that actually measured like experience of distress, and I don't know if that's the right outcome. No change in distress if you experimentally show people with menus with calories or not. And I think you're right that there was a really strong advocacy campaign, I think, called Beat, which gained a lot of traction, but whether or not that's evidence-based, I think that's the argument that we're in, right? If we're saying we don't think it works, well, then maybe we do have to listen to the people who are saying we don't like it, versus what do you think of this? I wanted to ask you specifically. What do you think of this out-of-home sector?
Good. Go ahead, Mike.
Can I make my point first? I don't think you should despair too much about the monitoring business. I mean, some local authorities are better than others at it, and some will take up cases. If a consumer makes a complaint, I think they're obliged to do it. And there have been some successful cases in the courts where companies have been found guilty of infringements to labelling. So I don't think that's happened very recently.
No, I don't think it's happened for out of home specifically. I mean, there is a list of, you can look up these cases.
Yeah.
And I didn't find any. Yeah.
No, well, in terms of the out of home, I'm still in favour of Nutri-Score, and there are some interesting studies going on both in France and the UK on putting Nutri-Score on labels, because I think it's infinitely better than the top one, and I think it's smaller in a way than the traffic light labelling or even the health warnings, because it's just the writing is smaller, so it's easier to put on your menu rather than you've got such a lot of information on the traffic light labelling and on the health warnings. So I think I'm optimistic about use of Nutri-Score for calorie labelling, but the problem is with the British government bite that bullet, or they will always want traffic light labelling, because traffic light labelling is the one we've got for retail foods.
Yeah. Well, but if you could
invented here and not by French.
Yeah.
you could get Nutri-Score out of home, you could re-engineer this and have it on grocery as well.
Yeah, yes, I think there's some issues about whether Nutri-Score works for high calorie foods, because most of the foods, I think you're showing that, aren't you, in your data, that most of the food items in these on these menus are a lot bigger than 100 grams, for example. And the Nutri-Score and the traffic light labelling work better for 100 gram, where foods are 100 grams in portion size, which is mean.
Better for more than 100 grams or less?
Well, there's problems with very small portions.
Yeah.
It's like mustard comes up with high and everything, and then you only eat a tiny bit. But there's also problems with large portions like ready meals and burgers, even where it seems to benefit well, it's a complicated story, but it seems to benefit the foods with high sugar and salt foods. So I think some adjustments. I think even the French are thinking they should adjust Nutri-Score for the out-of-home sector, but it wouldn't be too difficult. It's just put a calorie cap on things.
Yeah. Okay. Well,
There was a comment in this. Was Lauren? Did you put your hand up?
I didn't know.
Oh, just small. I saw a hand. Alex, you just jumped in. Go on, you next.
Thank you so much. I was thinking about sort of providing information at the point of purchase, and I think you kind of showed that there was an increase in people noticing the calorie labels, but it wasn't still quite a lot. Like the majority of people still weren't even noticing the calorie labels, and I think this is something that we found in my PhD work as well, is that people don't really are perceptive to information that's provided at the point of purchase, no matter what that might be, just relating to the health and sustainability of the food that they're purchasing. I think they're driven more by visuals and taste and appeal and things like that. So I was wondering, what's your take on this? Maybe it's not the information itself that's not useful. It's like where and how we're providing it. But I also don't have an answer to okay, then where else do we provide it?
Well, that's what I was going to say. Yeah. I agree that certainly there's a lot going on when you're trying to order. And certainly, if you're with friends and in a restaurant, you just have to choose something, right? And maybe, this is really anecdotal, but one of the field workers who was doing the Intercept survey said that she felt that there was kind of two groups of people here. There's people who are going out for a special occasion, like birthday, whatever. And there's people who come every morning for their coffee, right? And in neither situation is it particularly deliberative, right? You come for your coffee, you just buy it every morning. That's what I get. I don't even look at it.
Exactly.
Whereas the other group, well, it's a treat, so even if I noticed, I don't really care. So it seems to me and maybe there's another group somewhere in the middle, but actually there's a very small group here who this might even influence, and you're right, then they have to really, really care to hunt it out and do something. And there has to be an alternative. This actually was the meal that I was asked to choose 3 months ahead. And I didn't know what to do because like none of them are right to me. So it was best just to turn them off and go with what I fancy.
Okay, we have some questions at home as well, so I'll take these two here and then we'll go to the ones at home if that's okay. So yes.
Quickly, what's the trend for home cooking? Like eating out for me is a special occasion. I don't expect, unless it's a salad bar, I don't expect any nutritious stuff. It's social.
Yeah.
So what's the trend? I mean, because you would think if it's a true emergency in terms of health and diet, then finding folks who are ready to try out home cooking from scratch.
Yeah, so well, that's a bigger question of what should we do about all of foods. Right. And the trend is people are cooking at home less and eating out more, and people are spending less time on preparing food at home. So even if it appears home cooked, it's probably more semi-prepared by the supermarket. I mean, if you're asking me a question about what actually should we do about food, I agree that we need to get more, I would call it hand-prepared food to people, because when we say the answer is we need to do more home cooking, that triggers in my brain, so women need to get back in the kitchen. And
it is complicated. I understand. There'll be always be different demographics. And I guess because we feel it is an emergency, we want to see which demographics, maybe it's those are school kids who are more concerned and more a little bit open-minded and not exactly their habits might not be as set. And they hear about, childhood obesity or diabetes and think, oh, and my life expectancy is actually shorter than my parents and so on, So there'll be always different demographics. Some will just want to live fullest and not to bother, but we want to make sure that those who are on the cusp of making better decisions be aware, concerned, and learn more. That's available.
Yes, well, so the people who cook more are the older people, so people who are retired, so 60 plus, and may have grown up with it more, might have kind of developed those skills and reinforced them and now have more time to do it. People who cook the least are kind of like 30s, 40s, people who might have really busy lives with home life and work life kind of becoming chaotic and overwhelming. Is that what you were asking? Like, who is it who cooks?
Yeah, I guess it's sort of, affirmative. And I assume, I'm just saying that maybe that's something alternatively can be targeted, those groups that are.
Yeah, okay, well, so, I mean, I agree that we need to get less processed food to people. I'm not sure it's through getting people to cook at home. I think it might be because it seems that people are opting not to do that because their lives are complicated. So I think it might be that we need to find ways to get home cooked food into communities, whether that's through community meals, something like church meals that doesn't necessarily involve church, or through better supermarket provision of ready cooked foods, but not necessarily them put in a box and preserved.
There's a question here and then we'll go on. So yes.
Yeah. First of all, thank you so much for the presentation. It was great. And the question is about like the objective and the purpose of those who considering labels. Have you had any investigation? Because I remember I read an article about youth food and what they consume, and it was a kind of factor influencing what they have, like fast food and those. It was about social pressure, like friends pressures, that they go out and because they are with friends, they want to have like food or like cheap food or those things. My question is specifically about purpose of considering labels. Did you have investigation on why those people who consider labels, why they consider the purpose of their consideration? And by the way, that label with colorful is perfect. I love it.
Do you mean the people who take any note of them, or do you mean the people in policy? Why did they think it might work?
No, the people who actually consider, like
Who is it that notices them?
Yeah, during the interview that you had with the people, did you consider this item?
So we haven't done that analysis, but I can tell you from previous work that there is a kind of a preponderance for women, more affluent people, white people to notice labels more. So like, it kind of It's often kind of labeled as these are the people who are health conscious. So maybe people who are socially engineered, or social norm is you should care about what you eat, are in fact caring about what they eat.
But maybe sometimes, because in terms of environmental labor, sustainable environmental labor, I saw in the articles that this kind of consideration is a kind of prestigious for some kind of society, that they feel like they are from a high level of.
Well, like we can care about our food. Well, so yeah, and I think that fits with what I was saying. More affluent people are more likely to use labels.
Right, Lexi, your job is now to kind of try and summarize the questions that have been in the chat. So,
So there was a question around, rather than asking the damage for people who have pre-existing eating disorders, what might this I think calorie labeling potentially drive people towards more disordered eating from seeing the labels on there?
Yeah.
And then like, how does that warp our experience of food? Or has the modern food system already done that? And that's an unnecessary and natural flex.
Yeah, I actually feel very unqualified to answer that question. I don't know what it is that causes people to experience eating disorders and whether this increases risk. I have heard people say that, but I don't have the evidence. I don't know if anyone else here.
Well, I thought NIHR were commissioning 2 pieces of research.
I think they are.
They haven't been published yet.
No, not as far as I know.
But in parallel with your study, they were
Yeah.
looking specifically the effect of calorie labeling on eating disorders.
Okay.
With eating disorders.
So there might be evidence coming out.
Yeah.
Annie had a question around fast food companies. Are people like the restaurant industry or fast food companies kind of happy that researchers and policymakers are distracted with assessing calorie labels instead of getting behind ending advertising that is obviously also influencing you to go to?
So what are food companies? Oh yeah,
Celebrating the fact that we're distracted by calorie labels.
Yes, I think probably yes. You know, and that comes back to what I said about the public health responsibility deal. This was a thing that people were willing even to have on the list of pledges and to sign up for because they were fairly sure it didn't really matter. Yeah, and it keeps us busy. Like that comes back to we've got limited political capital. But I also think it comes back to this question about scrap it or optimize it. That maybe, I think that's what you were saying. Now we're here, we should probably try and optimize rather than scrap.
Just even about the responsibility deal, because I was when we did it. And I think we need to remember the context of the time, because this is when New York had just introduced labeling. People, the public health community were clamoring for labeling in out of home. There was huge pressure to do that. Industry were not that, we're not that keen, but they were, certainly some of the chain restaurants were persuaded to do it. And actually McDonald's were one of the first movers in this. So the burger chains really did go first. So I think that there was an opportunity, but government did not follow up with enforcement, compliance, sort of pushing on with it, making it happen. It was absolutely voluntary. If you fancy doing this,
Go ahead. Yeah, actually, if I'd had time, I might have pushed further on the history because I'd forgotten that it had been Bloomberg, right? Yeah. Mike Bloomberg had implemented it in New York, and then it had actually got into Obamacare. I think it's in that act in the US and applies to any chain with more than 20 outlets. But it also took them ages to get from the first mention in policy to actually implementing. I think it took them 5 or 6 years.
The other bit we haven't talked about is the burden on business. So I mean, I'm so conflicted. I do not, I don't know what advice to give on this, but there is a significant burden on business in doing this. And it limits menu reformulations, and arguably it makes it harder to be more flexible and therefore increases weight. There's a whole list of arguments, and I don't know how true or real they all are, but it for sure is burden on business, and there's a cost to doing this. And I think that in all this talk of regulatory burdens, I wonder whether it would help public health for us to acknowledge, this isn't working as brilliant. There is a burden, and so we'd prefer you to be putting your efforts somewhere else. So I think we do need to sort of factor that level in as
Yeah,
well.
no, I agree. And they describe both the data pipeline and getting the information. We're talking about accuracy. And also that was the best. There was a really nice quote in the call of, a war in Ukraine means that we've had to replace this sort of oil with that sort of oil, which has implications. And and we've got 30 days, something could be on the menu 30 days before we have to change. And someone has to be it's one guy's job just to find oil and another person's job to notice that has more calories or fewer calories to update. So, it's clear that there is some.
That's a complicated political argument to then go and say, oh, well, okay, we'll go here. And that's not we can clearly see that we could keep talking for a long time, but we've reached the end of the hour. So I think we're going to have to wrap it up. So we'll just say thank you again to Jean. Fantastic. And just one thing to say is that there was originally advertised that there was going to be a seminar next week, which was Anna Taylor from the Food Foundation. Unfortunately, she's had to cancel because it's clashing with an important meeting around